So IBD is inflammatory bowel disease. It really kind of comes in two different flavors. There's ulcerative colitis, there's Crohn's disease, are the two primary forms of inflammatory bowel disease that we see. They can present from a wide range of symptoms. Everybody is individualistic and you have to approach everybody that way. Inflammatory bowel disease is very common and can affect anywhere from children up to middle-aged adults to older-age adults. So the most common symptoms that we see are abdominal pain. It could be diarrhea, blood in their stool, weight loss. Some patients can have extra intestinal manifestations of inflammatory bowel disease. So IBD is diagnosed. I look at it from several different angles. I'd say the key component of it is what the mucosa looks like, doing an endoscopic exam, whether it's looking up top in the upper GI tract, lower GI tract, or some patients can have it just limited to the small bowel. And so we look at it from several different angles to make the diagnosis. If you're recently diagnosed with inflammatory bowel disease, there are a lot of options for treatment. Your symptoms can be very severe, and we understand that, and there's a lot of medications out there, and sometimes it's primarily medical, sometimes surgery is another option, but there's a lot of treatments out there to get you feeling better. It's important to work with your gastroenterologist because a lot of the symptoms that people can present with inflammatory bowel disease, they oftentimes are very similar. They're very common GI complaints, abdominal pain, diarrhea, sometimes blood in the stool, but they're very common GI complaints. It's important to work with your gastroenterologist to get the diagnosis correct, and so we can get you the right treatment to get you feeling better.